Thank you so much for taking your time out to come here today. And I want to welcome you to our workshop today. Our workshop is on reducing youth substance misuse by implementing mental health initiatives. And it is truly my pleasure to see such a diverse and dedicated group of professionals, educators, community leaders, and advocates gathered here today. So if you could put it in the chat so we can start making sure that the chat works, and also your name and where you're from, especially if you have some type of pseudonym as a name right now, because we want to make sure we get your certificates correct as well. So if you're under a name other than your real name, please definitely put your name in the chat and the state that you are from. Our focus today is on holistic approaches that integrate mental health strategies to prevent substance misuse among young people. And we know that the challenges our youth face are multifaceted and definitely interconnected. Substance misuse often stems from underlying mental health issues, which, if left unaddressed, can lead to a cycle of dependency and adverse outcomes. So by addressing these root causes, we can not only prevent substance misuse, but we can also promote overall well-being and resilience in our youth. So let's make today a productive and transformative experience. And that comes with your participation. So together, we're going to create an environment where our youth not only avoid substance misuse in all of our states, but they also thrive and achieve their fullest potential. So again, I want to thank you again for sharing your time with us today. And we're going to go ahead and get started. A little housekeeping measures that I have for you is this is our acknowledgments. And it just explains that the opinions that you hear expressed in this presentation, and they are the view of the PTTC network, and they do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions that you hear described in the document are intended or should be inferred. And you will receive this slide deck in about a week or two after this presentation. So if you want to read this in its entirety, you'll have the option to do so. But most important, I just want to make sure everyone knows that now, because that's often a question that we have during the presentation. Can I get the slide deck? It's going to be sent to everyone. This is our learning objectives for today. And we want to describe the relationship between youth mental health and substance misuse, first of all, as our foundation. And then we want to help you develop an understanding of the practical approaches for incorporating mental health initiatives into the existing substance misuse prevention programs that you may be using. Last, we'll examine various tools and resources that are available to support young people in maintaining their mental well-being. This is our roadmap for today. So we'll start off with a brief icebreaker with you. You've introduced yourself already, and I'll introduce my co-facilitator to you in a moment. We'll talk about youth mental health. We'll talk about some practical approaches for incorporating those mental health initiatives that she is an expert in. And then we'll have a group discussion and share some tools and resources with you. At the end, we will have an evaluation, and I urge each and every one of you, please do our evaluation. The more you share with us, it improves the services that we provide and also gives us an opportunity to get feedback from you as well. And that's always helpful. Richard Feinberg, who you see, is our tech guru that's with us today. He's helping to keep everything together behind the scenes. So if you have any technical issues, feel free to reach out to him directly, and he'll answer those questions for you to make sure that you stay well connected and engaged today. I'm also joined by Wanda Hudson, my partner in work, and she is truly one of the best facilitators and and researchers, and she also, with all the material that you see that has been put together today, she is our expert in that area as well. So she often goes unsung, but she is a hero. Also have Katie with us. Katie is also on our team at the PTTC. She's our, I think, statistician, or if I said it right. But she deals with a lot of data. She's a data expert, and she helps crunch those numbers. And also she provides presentations as well. But she's here as well. And if you have any questions that are related to data, then I'm sure she'd be wonderful and welcome to answer them. So without further ado, I want to share our primary speaker with you. And her name is Cindy Rivera. She's a change consultant project director. One of Cindy's favorite quotes is, "Listening is where love begins. Listening to ourselves and then to our neighbors." That's a quote from Fred Rogers, if anyone is familiar with that. So Cindy is a change consultant, and she specializes in early childhood and mental health across the lifespan. With over 20 years of nonprofit experience working at the community level to implement programming to meet identified needs. She worked across communities from Tennessee to the American Samoa on issues ranging from community volunteerism to chronic disease prevention. And Cindy believes when community members are seen as experts, organizations may begin to support innovative solutions to complex challenges. She holds a master's degree in social work from Arizona State University and a master's and bachelor's degree in Mexican American Studies from the University of Arizona as well. She is originally from Arizona. However, she spent the last 9 years zigzagging the country as a military spouse. Thank you for your service, Cindy. Currently, she resides in Fort Moore, Georgia, but will always call Southern Arizona home. We're going to start getting a little familiar with each other, and I just want to update you on Annotate. If you've not used Annotate in the past, we're going to use it right now. And for the next activity, we're going to use the Annotate tool. So click the Annotate button at the top of the Zoom window where Zoom says, "You're reviewing my screen" in green. You're looking for a special pencil that says Annotate. And if you don't see it, you might see an option that says View Options, which will then bring up the other option. Has everyone done that? Okay. After you've done that and clicked on that, I want you to choose on that bar a pop-up. Click the check mark for a stamp, or pick the heart shape, and then practice stamping in the gray area that you see on the screen, in the gray. Okay, quite a few of you are very familiar with Annotate. Thank you. That's going to work out great. Thank you for practicing. In the next slide, we're going to put that skill to work. And you'll place a stamp on the part of the spectrum where most of your work occurs. Most of your work. So without further ado, I give you Cindy. Oh.
Thank you, Derek. I very much appreciate your very warm welcome and introduction. I'm excited to be here. And as you all look at this image and try and find where along the spectrum your work occurs, you can use the annotate function to do that. I'm going to tell you a little bit about what we're looking at. So the mental, emotional, and behavioral health spectrum is a framework that encompasses the continuum of mental, emotional, and behavioral well-being. So it ranges from optimal functioning, to to severe impairment. It recognizes that mental health is not simply the absence of mental illness, but a dynamic state that is influenced by various factors that can include genetics, biology, environment, and life experiences. The MEB spectrum highlights the interconnectedness of our mental, emotional, and behavioral health, and it also emphasizes the importance of early intervention, prevention, and holistic approaches to well-being. I see so many annotations here. I think we should take a look. I'm so excited to be in a virtual space full of preventionists because I'm such a firm believer in early intervention and prevention and got my start in nonprofit there. So it looks like you all are mostly in those two first wedges that are the health promotion and the prevention areas. We have a few people working in treatment, a few people working in maintenance, which includes long-term treatment and aftercare. So this image was developed by the Institute of Medicine, IOM, and is based on the classification of populations based on risk levels and the developmental onset of mental, emotional, and behavioral disorders. There are costs and benefits of delivering interventions to targeted populations, and it varies along the spectrum classification. So, right, as we select different interventions, who that is aimed towards would vary based on their severity of kind of mental, emotional, or behavioral health needs. It's undergone an update, and it included renaming the spectrum as well as the pie wedges in each part, and they're sized to represent how resources should be allocated across various components. And I know all you preventionists love to hear that, because I think for years we knew that the funding around prevention and treatment was pretty lopsided, right? With a lot of funding over towards the treatment side. But in this model, we see more equal wedges, which I think is really exciting. So all those preventionists love to see it there. And we're going to move forward and start looking at, oh, there goes all of your beautiful drawings. So erase so quickly. About the major challenges facing mental health services. So, and specifically around youth. So first off, lack of access and affordability. So what is this? How does this impact us? Well, we know that access can be things like the high cost of mental health services, insufficient insurance coverage, and long waiting times for appointments, and that limits accessibility. We also in this have geographical disparities. So about 160 million Americans live in a mental health shortage area. And that's about 75% of the rural population are in these areas where there's no provider within 50 to 60 miles of them, meaning that in order to access services, they're hitting the road. So all those other things have to be in their favor, transportation, time off. So there's huge disparities there. And we also have this, and I think anyone working in mental health right now would agree that there is a mental health workforce shortage anywhere from clinicians, whether they be social workers or LPCs or licensed marriage and family therapists, all the way to psychiatrists, peers. It's the entire workforce. There's a mental health shortage. And then we have our fun thing that we all play on, social media. So we have the good, the bad, and the ugly surrounding social media. We know that some of the things that social media can do is increased depression and anxiety around youth. The Surgeon General, along with the American Psychiatric Association or Psychological Association, now I'm doubting myself, have both issued warnings about youth and social media use and mental health. And then finally, just the systemic racism and inequities that certain populations face based on many identities that make them part of a marginalized group. So those are all things that continue to plague kind of mental health services in this country, which is kind of the foundation of where people are coming to for services. And yes, stigma is there, and we're going to talk a little bit more about stigma later. And we will move along. I see so much chat, and I'm sorry, it's hard for me to do two things at once, but I will, while Derek's talking, go back and read the chat and respond. So, what's the data say? Well, this data from 2021 looked at poor mental health in youth during the past 30 days. So what are we seeing? That overall, the number of youth or the percentage of youth that are reporting poor mental health is sitting around 29%. But then we see these huge disparities, right, between male and females, you know? What's going on there? 41% of females reporting poor mental health versus 18% of males. We look at other populations like LGBTQ populations, and we're seeing 52% are reporting poor mental health. And I always back this up in the past 30 days. That's how the question is worded. These are the 30-day stats, not in the past year. Because I know those of you that have looked at the Youth Risk Behavioral Survey data that comes out from the federal government, usually there's that 30-day and then the year. This is in the past 30 days. So it's really only capturing a segment of the population that is in poor mental health. We start to think about like what would multiple marginalized identities, someone that is, maybe a female and multiracial, how is that impacting their mental health? So these are things that really are important to consider. And here, I think this is where some of the comments around stigma may come into play, because some of this may be underreported due to stigma. I look at the males, and we have more data coming out more recently that are showing that young men are having more depression and anxiety, and I can pull some of those stats a little bit further along, but so there could be stigma in reporting, and of course there's stigma in accessing services. So, and the other thing is we got to think about these kids, 18 and under. There's a lack of awareness. Like they may not even fully understand what, optimal mental health is. Do most adults? So when we think about that, they may attribute symptoms like anxiety, depression, or mood swings just to I'm an adolescent, or their parents might be attributing. It's that very fine line between, and as a mother of teenagers, I can say, is this anxiety and depression, or is this being an adolescent? And that can be really hard to distinguish. And then we know that there's some inadequate screening and support for youth in these age groups. There are some very progressive programs that will screen youth in schools, And that's some of the population, but screening throughout primary care and schools, all of these things are approaches that could help identify services for kids that are facing some mental health issues. I'm gonna move forward. Um, and so we know the pandemic really hit um, kids in high school hard. You know, they were isolated from their friends and their regular life, and more than 1 in 3 reported that they had poor mental health during the pandemic. Um, Nearly half of these kids felt persistently sad or hopeless. And then like I talked about earlier, the students with kind of intersectional identities that maybe had multiple they were part of multiple marginalized groups are experiencing disproportionate levels of poor mental health and suicide related behaviors. Compounded with that, we know that during this time and still that racism and systemic oppression are impact mental health. And we see that Asian, Black, and multiracial students are reporting high levels of racism. So I see some great things in the chat, and it's so hard for me not to just respond. But for right now, we're going to pause and ask for questions. So any questions? Okay.
If it's easier for you to open your mic and ask your question, we'll allow you to do that also.
Okay.
Okay, we'll move on then.
Okay, we'll move on. Okay. So we're here to talk about prevention of substances, right? And how that intersects with mental health. Well, we know something about this. So looking at the data here in the blue column, you'll see these are youth 12 through 17 that either in the blue had a major depressive disorder or in the red did not. And we see that their use of substances is exponentially higher than if they did not have these major depressive disorders. So there is co-occurrence between substance use and mental health disorders. So we are definitely able to look across kind of all substances here and see that it's at least double in most cases, right? The substance use of youth with major depressive disorders versus those who didn't. So that's a place to start, right? We got to start peeling back the layers of the onion here. And I know Derek likes to ask a question. Are you going to ask the question at this point about?
I'll wait.
Okay. But so these are things that it's good information to have, right? And we need to understand that there are barriers out there to substance use and mental health treatment, right? So it's on both sides. So if you working the substance use behavioral health side, barriers to treatment. You turn around and in some cases it might be, you know, in the same space where someone can get treatment, in some cases not, or you're trying to get mental health treatment, there are barriers. So these barriers such as lack of insurance, loss of insurance, stigma, and it really impacts the ability for youth to get treatment, whether it's for their substance use or mental health. Any questions, sir? I'm gonna keep plugging along. So, kids with major depressive disorder have higher rates of drug use. We know this. So is it the depression or is it the drug use that's causing the depression? That's like what came first, the chicken or the egg. It's really individualized towards the individual. In some cases, a clinician might be able to think about how early on there were signs of depression and perhaps they were not able to get treatment and then they started self-medicating, right? That's a road that's not uncommon. So what does that mean for us? It means early identification, right? Getting early on the MEB spectrum and intervening early for better outcomes, right? That's why the wedges are all the same. Is because we know that early intervention is key to higher costs later on. Depression and alcohol use disorder often co-occur. You'll see this with kids, you'll see it with adults. I've only spent this much time working with adults. Mainly I've worked with youth, but the co-occurrence is very large. And then because individuals with depression have a threefold risk of developing alcohol use in their lifetime. So again, early identification, early treatment really can be supportive to steer people away from using substances as part of their coping. Sorry, there's just crashing happening in my house, but so we know that. And I am going to move forward here.
So
Here, okay.
It's going to be posed in the chat for you now, and that is and especially, I want you to think about this. We're showing this video for a reason, and as you watch it, I want you to look for connections between mental health and substance misuse. As Cindy has already talked with you, that we had the COVID-19 pandemic era that ushered in a whole new set of challenges for youth in the United States, and it led to a mental health crisis as declared by the United States Surgeon General. That was just over a year ago, but our U.S. children and teens have been suffering for much longer than that. And in the 10 years leading up to the pandemic, we saw consistently in different reports feelings of persistent sadness and hopelessness, as well as we watched suicidal rates increase and increased reporting of suicidal thoughts and behaviors. That increased by about 40% among young people, according to the CDC. So with that all in mind, we know that kids' mental health is in crisis. And that was one of the primary drivers of why we put this presentation for you together today, because psychologists are trying to do what they can to help, but preventionists also are in a unique position to be able to help these youth as well, because research that's focused on youth and teen mental health, it really explores why they're struggling and what can be done to help. And as you look through that and you learn more about that, you start to see, and that's what we're going to be sharing with you today, some of those things that you can do. So I want you to watch this brief video, because majority of you work with youth and think about the connection between mental health and substance misuse, because you might be seeing some of these signs within some of the youth that you're working with, and it might have gone unnoticed.
Mental health conditions are more common than you may think. 1 in 5 youth or young adults lives with a mental health condition. Do you know the warning signs? Like feeling sad or withdrawn for more than 2 weeks. Severe mood swings that cause problems in relationships. Intense worries or fears that get in the way of daily activities. Sudden overwhelming fear for no reason. Or seriously trying to harm or kill oneself, or making plans to do so. not eating, throwing up, or using laxatives to lose weight. Significant weight loss or weight gain. Severe, out-of-control risk-taking behavior that can cause harm to self or others. Repeated use of drugs or alcohol. Drastic changes in behavior, personality, or sleeping habits. Or extreme difficulty concentrating or staying still. If you see these signs in yourself or a friend, tell a trusted adult. The first step to getting help is to say it out loud.
As you watch this video, I want to know like some of your thoughts. If you want to open your mic and share your thought in there, what are are you seeing some of these signs in your community or in some of the people that you're working with? And you can put it in the chat if you prefer.
Hi, this is Carmen from Tennessee. I'm with the Oasis Center, and I work with international students. And so I have seen some of that behavior in not only my middle school, but also my high school. And usually I'm able to see the difference in behavior. And so we work closely also in the schools with Centerstone and STARS. And so then I just usually I'll talk to them a little bit, and then I'll refer them to the STARS representative of Centerstone, and they'll reach out to the young person.
Okay. And we know it's a challenge because especially dealing with teenagers, trying to differentiate from the normal teenage behavior as they're going through those changes. But I'll allow Cindy to expand more on that. I just thank you for sharing with us about something that you're seeing as well. And we'll also be reviewing things that we see in the chat. I see several things. People are experiencing depression, and they're making their depression worse with drinking because of alcohol. And is a depressant? Absolutely. Suicide risk is also higher. I think something that's common in our schools is the topic of leadership and team addresses continuously. And eating disorders and mood swings are common. Yes, they are, and huge indicators as well. So as we work with this population, we often see some of these things, and some of them may go overlooked because we see also normal teenage development that's occurring that has some of these things involved in it as well. So, Cindy, can you talk about the importance of then incorporating those mental health strategies into
Yes.
what we're doing?
Of course. So incorporating mental health strategies can have such a huge impact because this mental health integration is a promising solution to addressing an individual's total health needs, right? So we're looking at reducing that it can help improve health outcomes, reduce overall healthcare costs, increase the quality of life, and then also provide person-centered care. So by improving health outcomes, integrating mental health strategies leads to better management of both mental and physical health conditions that can help overall well-being. It can reduce healthcare costs by preventing and managing mental health issues effectively. So healthcare systems can reduce costs associated with emergency department visits, hospitalizations, and chronic conditions. So I think most of us know that the most expensive place to get healthcare is the emergency department, right? And so in an effort to really offset those costs, early intervention, incorporating mental health into the places where youth are helps us reduce those costs. I'm going to always make a plug here for 988. 988 is a way to avoid the emergency department and get clinical stabilization for any youth. They don't have to be suicidal. If they're having a behavioral health issue or a mental health crisis, you can call 988. It's not just the suicide line anymore. So, and that is to help reduce those healthcare costs. An enhanced quality of life, because we know that addressing mental health improves patients' quality of life. It helps their relationships. It helps them do better in school and work. And it just overall daily functioning, right? The daily activities become easier when mental health issues are addressed. And then finally, person-centered care, which is mental health integration that allows for personalized holistic care, looking at the individual's needs and preferences. So we're doing things that align to fit the patient or the client in order to maximize benefits. Because if we do some type of intervention that is not aligned with how they are going to continue to live their life or the environment they live in, then we're just, wasting time and effort. If we really look at clients as they are, where their strengths are, where they need support, we can provide this holistic care that will have better outcomes. Yes, I saw some of that chatter about, substance use versus mental health disorders, what comes first. I think research is always going to continue to come out on that. And I saw someone recommend a book about kind of this issue, but it's personalized towards each person, and I think that our research base is getting better, so we'll learn more and more about that. So next we have
I want to pause for a minute. Riley Ford has shared with us that as a 20-year-old, she agrees with this because it makes youth and young adults like myself feel like how we're feeling is wrong. So we stop reaching out and we stop asking for help, which is extremely dangerous. So I thank you for sharing your perspective with, especially as a young adult, because that gives us insight when it comes to working with this population. So thank you for sharing, Riley.
Well, and I really appreciate, I think she was responding to the comment above, which was about how adults can minimize the problems that adolescents face. And this is something that we have to start retraining adults, to recognize that if someone is coming to you and expressing there's an issue, to take it seriously no matter what, because intervening and supporting is always a preferred way than to shut down. Like, we hear many stories of youth that do not access services because they didn't feel like they could because of all the stigma around it. But if we could start changing our reaction, modifying how we react to youth who are expressing crisis or challenges, and we can really cut it off. It's hard as a parent. I'm a parent, so I can say, by my own lived experience, that sometimes, because you're living it with them, and it's hard for you to see what they're going through. But we don't have to see it, right? We just have to affirm it and start getting the help. So
That's because if ignore it or push it away, then many times it exasperates disorder in the long run when that happens. We know that suppression of feelings and things like that in the long run, it eats people up on the inside. It doesn't just go away. So that's good advice.
I would say, and there's also a question about a particular screening tool that's recommended to sort out other behaviors. I would start with to try and access, whether it's a school counselor or someone in community, to do a screening. So there's different screening tools that will be appropriate for that age group. in some cases, different identities, because I just had run into an issue with someone using a suicide screen that was not normed on autistic kids. And you have to consider that. So
Our
so
speed tech team member,
definitely
our
uh,
speed tech team member, Sean Burns, has put in several instruments and tools to use for screening, including the PHQ-9, the Beck Depression Inventory, and the GAD-7. Thank you, Sean.
and it's best to do this with a clinician. So I will say that. So, and I see we have a hand raised.
Megan, would you like to unmute and ask your question?
Yeah, so when we were just talking about retraining adults, so I work as a substance use specialist and prevention specialist, school-based. I am in 4 middle schools, 3 high schools, and the Alternative Learning Center. And so I've seen all of the mental health concerns that were listed on a couple of previous slides, and I've taken a lot of time with attending staff meetings to talk more about recognizing your student likely not just going to walk up to you and be like, I'm experiencing a mental health crisis or there's something going on, but being able to recognize those signs, knowing who in the building could get there to help that student, making sure we know who the student's support person is within the school, and then working on building hopefully some groups to work on, coping skills and protective factors, and while continuing to educate youth in their health classes and all of that. So I'm kind of in the process of rebuilding the program in this district. And so this is a great presentation for me, to hopefully help me be able to support the students in my community.
Well, and we'll have some resources at the end that are specific kind of to schools, and I can put my email in the chat also, and you can we can chat about that too, because
Oh, that
these
would be wonderful.
these the way you move forward with this, school district policy can sometimes guide this, state policy, and so and then there's just the resources of it all, right? So it can be complex.
Correct.
And so there's some strategies around that. So we can definitely chat more. And so what connections are you seeing in your community that around what we've talked about? How is this showing up there?
I think some people have started to share some of those in the chat as well,
Yeah.
but specifically, we'd like to know what environmental or social factors do you think contribute to both mental health issues and substance misuse within your community, and also, like, what are some common mental health issues that you observe among youth in your community?
So, and I do want to respond to Randall Wilkins, which I could not agree more with what you're saying about schools routing to the ED for anyone that has some level of suicidal ideation. That is not aligned with our national guidelines for children and youth in crisis. We always want to go with the least restrictive environment, and that is not usually the ED. So that is something that I'm actually quite passionate about, is really getting people to understand that youth crisis guidelines no longer say go to the ED. The new guideline is call 988. There should be someone it's a place to call, text, or chat, someone to respond, mobile crisis coming to the person, or crisis stabilization. More of kind of a urgent care for mental health crisis, where a stabilization is done, community supports, and then back released into an environment that is the least restrictive. So this is something that is evolving, and crisis framework has changed in the past like 5 years-ish. So hopefully that systemic barrier is getting a little bit better. So
Also noted from Shelley that one of the communities that she works with has a high rate of poverty, and that there also attendance in school is a real concern. And from Casey, working to improve the LGBTQ mental health disparities in rural Oklahoma has been very difficult.
Their NTAC, which is another TA center I work for, just did a whole series on chronic absenteeism. So that might be a resource that I'm going to go ahead and point you to that website, but you can watch all the recordings of their past webinars. That might be helpful to you. Fantastic.
Let's
Great,
look.
thank you.
Over to you, Derek.
Let's look a bit closer at prevention science. And when I talk about prevention science, the foundation of it being those risk factors. I ask somebody at this time if you'd like to participate, please unmute your mic and just read to us the definition that you see on the screen of a risk factor.
An attribute, characteristic, or exposure that precedes and is associated with a higher likelihood of problematic outcomes.
Okay. So, as preventionists, of course, this is the foundation of the work that we do, recognizing those risk factors and then understanding, what, not diagnosing, but also just giving us a better idea of what is impacting the youth within our community or the adults. What's impacting our community? What are those risk factors? This actually got started from Dr. Dahlgren. He was the first director of the Framingham Heart Study, and one of the most important research projects of the 20th century, because that study that he led in 1949 to 1966 found links between vascular disease, which was the leading cause of death in the United States, still is, to diet, blood pressure, obesity, exercise, and smoking. And he coined the term risk factor in 1961. And that term has now been applied to other diseases, disorders, and circumstances, and also even to events. So in the 1980s, Dr. David Hawkins and Richard Catalano at the University of Washington compiled a risk and protective factor for substance misuse and other problems occurring in adolescence. With that being the history of where we're at, then let's look at those protective factors. And again, with the protective factors, if anyone who's available wants to unmute and just read protective factors for us.
Any attribute, characteristic, or exposure that precedes and is associated with lower likelihood of problematic outcomes.
Hey, thank you very much. Megan, thank you, Megan. I appreciate you.
You're welcome.
Your participation. So easy to understand, been around for a while. Again, one of the foundations of the work that we do. But what I want to emphasize about those protective factors that they reduce the negative impact of the risk factors. So foundation of the work we're doing in prevention, we're trying to reduce the risk factors and increase the protective factors within our communities, because those protective factors are going to decrease the problems. Resilience plays a part in this as well. And that's the ability to recover from or adapt to adverse events. And I think we all acknowledge that everyone comes with a different level of resilience. Some of us have grown up or experienced some traumatic and terrible situations as a child, but we were able to bounce back and somehow recover and become productive citizens of society, while others have fallen to the circumstances. Resilience is something that we can also build in our youth, and we have to work to try and help the youth build resilience. Culture is going to play a part in that as well. Some cultures work and build resilience within their community. Truly, in the African American community where I come, the resilience is applauded. It's built into you, even to a certain degree. It's like we even teach the youth, like, you have to suffer a little bit so you can get strong, and teach resilience that way. But it's not always the best path to go. But man, unlike the definition of risk factor, this definition from the Institute of Medicine, it also includes those cultural levels. So as you think about that, and you think about your own culture and the community that you come from, understand that culture is having an impact here as well. So prevention is not just about eliminating those negative behaviors. It's also about supporting the protective factors and striving to optimize well-being. And a big part of that is building resilience in the youth that we're working with. I'm waiting for the chat to fill up with remarks about that. So I'm sure that you all have stories about how you've been resilient in the work that you're doing and how you're helping to build resilience. So this chart right here that I share with you from the behavioral health lens for prevention is that shared and risk protective factor. And in here, through preventive interventions are often designed to produce a single outcome. Research now has shown that risk and protective factors are associated with multiple outcomes. I think we knew that, but it's out there now. The truth between substance abuse disorder and also mental illness disorder, we can work on those two things simultaneously. For example, negative life events such as a divorce or sustained neighborhood violence are associated not only with substance abuse, but also with anxiety, depression, and other behavioral health problems. So what that tells us is that preventive efforts targeting a particular set of risk and protective factors have the potential to produce positive effects in multiple areas. And those interventions with multiple benefits can lead to a broad improvement in health. And most importantly, as it's been shared with us already by Cindy, that's cost effective. We've heard the phrase "killing two birds with one stone" all our lives, and this is essentially what this is saying as well, because those risk and protective factors can strengthen or limit the presence of other factors and disorders over a lifetime. Risk factors such as poverty and family dysfunction can contribute to psychosocial problems and behavioral problems, such as risky sexual behavior and depression. Moreover, risk and protective factors within one particular context, such as the family, may also influence or be influenced by factors in another context. So, effective parenting has been shown to mediate the effects of multiple risk factors, including poverty, parental divorce, parental bereavement, parental mental health. So the more we understand about how risk and protective factors interact, the better we are prepared, and we can start developing the appropriate interventions. And in the past, prevention practitioners typically focused on a select group of factors that they thought contributed to a specific issue or produced a single outcome. But today, practitioners have begun broadening their lens, and that's what we're here to help you do today. So you can look at connections between risk factors and implement effective programs strategically to address multiple outcomes. Think about risk factors that are contributing to substance misuse specifically. This is a brief list that comes from SAMHSA, but you want to really narrow in on co-occurring substance use and mental health disorders being common. We understand that these things are common. They run together. And Cindy has shared, and the question I asked multiple times, like, which came first, the chicken or the egg? Is it the mental health that's causing the substance misuse, or is the substance abuse causing the mental health? And at this point, it really doesn't matter. It's like waking up in the middle of the night and finding your house on fire. You don't run around and start asking everybody who set the fire. You get all the people that you love and you get them out the house. And that's the point that we're at now. It's a mental health crisis that's going on. So empirical evidence supports this lens, revealing that several factors place young adults at increased risk for substance misuse. We accept that. And these are risk factors identified by at least 2 longitudinal studies that you see here on the list. And some of these factors emerge during childhood and adolescence and provide early opportunities to intervene. But other factors, they're more related to young adulthood, like friends engaging in substance use. They point to important social context, people wanting to be accepted. And you start thinking about, who are my kids hanging around? And what are some of the behaviors of that group? Because it's my daddy used to always say, I mean, you go to the barbershop long enough, you're going to end up getting a haircut. And we've seen that happen over and over again. So college is one of the primary grounds where you start exploring. They're away from their adults that were providing guidance. They're in a new environment, and they start to be influenced by what's going on around. Therefore, risk factors not only emerge at different stages of development, but also across the context of levels as well. So we have to constantly be on alert and aware of that. And when we see the signs like academic failure, or understand that the parents are involved in some type of substance use, or they think favorably of it, then we understand that youth has a heightened risk of getting involved in this behavior as well. That is one of the common tragedies that we've seen now, especially with cannabis. There was a generation before where cannabis was different. It wasn't as harsh as it is now. It wasn't as strong. So that generation is now, they have children, and their fear of cannabis is pretty much null and gone, because it's their parents as their leaders, or the leaders of their family. They don't essentially see it as a risk or see it as a danger. But it has been said on many occasions, like, the cannabis of today is not the cannabis of yesterday. And we just have to be aware of things like that. So those favorable views and perception of harm are starting to decrease in areas, and we have to reinforce in those areas so they understand that they're at risk. Some of the protective factors for substance misuse in youth, the things that make them strong, the things that protect them, are listed here from SAMHSA as well. It's ironic that gender would be one of those things, because conventional wisdom is right on this one. Girls get into less trouble than boys do. Boys just present more risk factors. They tend to be engaged more in risky behavior. But whether it's testosterone or social conditioning, boys are at greater risk for all the problem behaviors, except, of course, teen pregnancy. Not to say boys don't generally contribute to teen pregnancy rates, but they definitely do. So resilience and temperament, as we talked about earlier, that's also a protective factor. The more resilient your children are that you work with, or that you that are living in your community, they simply seem to be better able to weather difficulties than others. They can experience numerous risk factors without losing their ability to cope reasonably with whatever comes up. I grew up in Chicago, and things became like so common that we saw within our community. We built up the type of resilience where we were able to walk through crime-ridden neighborhoods without feeling even the hint of anxiety, because we were just so familiar with the area. You can say that's good or bad, but it's just something that developed the resilience. I see now, kid loses like one classmate, and the whole school shuts down because of this mental health crisis. When I was growing up, we were losing classmates every week because of gun violence in Chicago. And we just had built up the temperament and the resilience that we were able to continue on with our studies and our classes and do the work that we do. So, of course, positive orientation. Children have to be optimistic and cheerful. That will also be a protective factor for them. So the more activities that can be created within your community and that you can do with prevention to help build that optimism and give them choices and show them clear paths to make sure that their environment is being improved, will help them to start enjoying other people and also to appreciate themselves and they can be well liked, and that can reduce their risk of problem behavior as well. So that's just a small list of some of the protective factors. We're going to share a link with you in the chat as well that'll give you the full list over the life cycle. I see there's a lot going on in the chat, as Cindy did. I can't really get to it right now, but I will go back and look at it. So I really appreciate all the engagement today. And I have a poll for you now. The question is, which protective factor do you have the most influence over in your community? What do you influence? What can you influence? As we see, all of us work all the way across the spectrum in different areas, and everyone has some area that they can truly.
I love this. I love seeing the different areas that I would presume you all work in. So I think of what prevention programs you may be a part of. I know like family support, the Strengthening Families program, Strengthening Multi-Ethnic Families programs, like all those family programs that support that. Such great work. So mentoring programs with the connecting to a caring adult, you know. And one of the things that I always caveat like this, the adults should have some like healthy beliefs and clear standards too. So there are some caring adults that maybe have some unhealthy views that might not be as beneficial. So there should a little bit of a caveat there.
Finding out there were caring adults within my community just changed my life.
Right?
I promise you. And I'll tell you the story sometime, but just briefly, I mean, it was the COPS program that was in our community where instead of learning not to fear the police, we learned how to work with the police within our community, and they helped us to essentially break away from what was going on in our neighborhood and bond with each other and also bond with them as law enforcement officers, understand that they truly were there to keep us safe. So thank you for participating in the poll. Looks like we have a very good distribution. There's no area, obviously, that people in here don't have the opportunity or the ability to influence within their community. So together, we are stronger. Talk about shared interventions now briefly. I just want to make sure that you understand using those shared interventions to address the shared risk factors and protective factors that relate to substance misuse and mental health disorders. They offer several key benefits. And those shared interventions also leverage the interconnected nature of risk factors, like we talked about, such as trauma and family conflict and social isolation and protective factors like strong family bonds and positive peer relationships and community support. So when you look at this chart, it wants you clearly to understand that those are with those shared risk and protective factors. As you address those risk factors being on one side and protective factors, the shared interventions right in the middle, you can deal with substance misuse and mental health simultaneously. And through doing that, you optimize your resources. You're able to broaden your impact. In most cases, you can provide holistic care and consistency in messaging and support because you're working across the spectrum with each other on this issue. Like, you need to know the mental health professionals within your community so that as you do your prevention work, that y'all can collaborate with each other. You can work together to build resilience within your community, and you can really help to increase community, and family engagement. So using the shared interventions to address shared risks and protective factors related to substance misuse and mental health disorders is a strategic and effective approach. Now we look at some practical approaches for incorporating mental health initiatives, and that's one of the things that we had promised at the beginning as we're moving through our presentation now. But understanding that when as you work across this whole spectrum, we're clearly given the message that you need to collaborate and you need to develop new partners, because as you choose your partners and you develop effective strategies working together, that's when you're able to best leverage your resources and your funding streams. You need to also have a better understanding of the shared risk and protective factors model that we showed you. You'll get a copy of this presentation, but utilize this in your work when you're working across the spectrum to let them understand, like, these are our risk factors that we're looking at. These are the ones, and then let's look at some strategies that we can work with together in order to maximize our efforts in this area, whether it be through education or mental health curriculum. But before I go further, I mean, I'm gonna just ask my expert to go ahead and tone in there from the mental health world on some things that also some practical approaches for incorporating mental health initiatives.
Well, I think some of these things that we've talked about previously, such as like how do we build some of these pro-social behaviors, right? Well, we have prevention programs that do a great job at doing that, like Botman's life skills, and so they do things like teach communication, right? How to manage conflict, how to make a decision. So all of those things are approaches that I might use in social skills training as a clinician with someone that is in my office for mental health. So if these things are happening in two places at once, meaning maybe the school has a program and maybe they go to the Boys and Girls Club and maybe they're accessing mental health counseling somewhere. And that repeated message, the repeated ability to practice these skills really can support prevention and mental health treatment at the same time, because these things are not that far apart. You know, when I went from being a preventionist to kind of a clinician, I was surprised, like, oh, okay. I mean, there are some very specific things on the clinical side, but it all starts with prevention. If we're laying a foundation through good prevention efforts, that makes clinicians' jobs much easier. Things that we can do are, awareness programs. Some of it is, I always think of the social marketing around alcohol use. There is a perception that all the kids are drinking. That is not true. Usually those substance use rates are, less than 30%. So if we said 70% of kids are not drinking, like, that's the message to get out. Like, that's the awareness. And I was reading all of that about the THC of today is not what it was yesterday. We have long ways to go because we have opposing messages happening as marijuana is getting legalized for recreational and medicinal purposes, and then still understanding that this is a drug that has consequences that has not really been researched to the level as other drugs. So I see Megan has her hand up.
Yes, thank you. I just wanted to kind of touch on your prevention side of it and the wellness classes and focusing on that. If results from a survey say 12% of 11th graders are using alcohol. Okay, but so we have that 12%, but let's think about how many aren't. So I've been working really hard with my schools and with my team. I just joined my team last winter for the presentations we do in awareness classes and in the community. Like, yes, we touch on that, but we also need to celebrate how many of our students and youth are choosing not to use those substances. And to really make sure we're celebrating that. Because it is hard in schools today to when everything is so readily available by the touch of your phone or whatever it may be. And so thank you for saying that. Something I've been working on trying to do within my district and community.
Well, and thinking about that, I think the number one practical approach for incorporating mental health initiatives is community engagement. I will always say that. If we can
Absolutely.
engage our community in the way we are building and implementing and evaluating programs, then that's what makes it effective. That's what makes it work. So that youth voice, the voice of lived experience, has got to be an integral piece of how we walk out these prevention and mental health initiatives. So and I will say that's the most practical approach and equitable also. um,
So thank you, Cindy, for sharing that, and appreciate all the participation. What you see now is the interventions by developmental phase, and it just clearly, by looking at this, interventions for mental health and substance misuse, you can see clearly are vital at every stage of youth development. And by addressing unique needs of each development phase, these interventions can prevent issues from arising, whether it be from the initial stage or prior to conception, and providing that education to mothers, to prenatal care, all the way down to adolescence, where you're providing prevention of depression and prevention of schizophrenia, where there's an onset that usually occurs during that time. And you can do this across the whole span by making sure the right policies are in place within your community and continuing to provide community interventions. Cindy, at this point, could you briefly share with them some of the existing mental health approaches?
Definitely. So, some of the things that you have to think about as we look at mental health are accessibility. I'm gonna always say this, accessibility. If our programs are not in community where youth are, then we're missing the mark, right? Because no caretaker of a youth has time to be driving 50 miles, you know? So we have some things that are helping. Telehealth is one of those, but really centering mental health in the places where youth are is really important. Early intervention, the earlier the better. So any screening that can happen in schools, in doctors' offices, again, where youth are, can help us identify and get to treatment faster, reducing stigma. I mean, this is across the lifespan because, of course, it's not just stigma with the youth who I think are actually a little more progressed than adults, and definitely older adults, at wanting to access care and being able to express that they need that help. And then again, the holistic approach. We need to meet people where they're at and provide treatment in a way that works for who they are and what their life is like and where they live. All these things have to be considered, and all the things that are happening in their life in order to get treatment that really gets to the root of the issue. So.
This is a comprehensive list of some of the substance misuse prevention programs that do exactly what we talked about today. You see the list here. If you used some of these in the past or you're currently using any of these, you can just annotate a little check mark next to it so we can see how many of these are in place already. Okay, someone's using life skills, project alert, positive action. Okay, incredible years. We're going to get bingo here. We're going to get everyone All stars. Okay, thank you for sharing that one. Tax. Oh, wow. Are we preaching to the choir? You people are incredible. So if you don't use any of these right now, you've been in a room with someone who does. And we want to make sure that y'all be sure to network with each other while you're here as well. I won't go through a long description of each one of them because there are so many people who are familiar with them. But these programs have been rigorously evaluated and shown to positively impact youth mental health and to and also to prevent substance misuse, making them valuable tools for school communities and for families. So if you see any of these, well, you of course you're going to get the slide deck, but write down these if you want to right now. You can do a little research on them and pull them up. And we also have a site. We'll put a link in the chat, a site that'll take you to these as well. It'll be shared with you in the slide deck. I can't pull it down right now.
And I think also just considering who you're working with, and all of these evidence-based practices have populations that they've been researched on, and going to that research base and seeing, is this what's going to work for my community and who my identified population with, is really important.
Mental health and physical health are critical to our overall well-being. The youth mental health crisis was intensified by the COVID-19 pandemic. It's time for all of us to be equipped to support our youth. We can all help when a person is experiencing a mental health crisis. When it comes to youth mental health, families, friends, mentors, and even bystanders can be first responders. Here are 5 ways to help. Safety. Make sure there's no current danger of physical or psychological harm. Calm and comfort. Listen and ease their distress. Connect. Help connect them with a friend, family member, mentor, teacher, or coach that they trust. Empower. Build their confidence and reassure them that they're capable of finding a way forward and that they're not alone. Hope. Communicate hope and speak positively that things can and will get better. When you see youth in distress, you can help. Reach out, Seattle. Call or text 988. Together, as first responders, we can all make a difference, especially for the youth in our lives. Remember that mental health is physical health. The body doesn't know the difference.
We've reached the point now where we're at group discussion, but due to time, we're going to turn this exercise into just a chat. And I want you to briefly put to chat how you can implement youth voice initiatives to help reduce mental health challenges and substance misuse. If you could just put something in the chat that you feel that you could do to implement youth voice initiatives to help reduce mental health challenges and substance use. Put it in the chat so everyone can see it and share it with everyone. Something that you can do. Have them as part of the discussion. Okay, listen to young people. Have youth present at different tables.
Have them design a campaign, love it, like the social marketing one around who's really drinking alcohol, right? Community outreach, being available. Giving them some power, right? Peer-led education. Hope Squad.
Wow.
These ideas.
This group is an incredible resource, Cindy.
Absolutely. Oh, I love training them to support as peers. I will bang the drum on peer support forever, because there is nothing like talking to someone who has been through it to help someone who is going through some challenges. Youth coalitions, youth advisory councils. Absolutely.
Teach them how to empower each other. Okay, again. That's that peer-led, meet youth where they're at, create safe space for them to engage in alternative activities.
Here, there it is. Oh, a lunch bunch. I love a lunch bunch.
Well, that's new.
Yep. Yep. When I was working in schools, we had a lunch bunch, and it was helpful because there were some kids that just didn't feel like being in the cafeteria at lunch is dangerous for them. So,
So lunch bunch is like a safe space. Okay.
mhm. Nice.
Guys pretty much named everything that we were going to suggest to you, but of course, youth-led forums is another option, in student representation, and then of course, evaluate and adapt initiatives. As you start putting some of these things in place, ongoing evaluation is going to be important as well. Continuously assess the effectiveness of the youth voice initiatives that you've initiated and adapt them on the feedback that you're getting from your participants, because this interactive process ensures that the program remains relevant and impactful.
Love all the links. Thank you all that are sharing these resources with your peers. I think that's really helpful.
Well, let's move to the last phase of our presentation today, and that's where we share with you some tools and resources.
Okay. So the original iteration of this presentation, we talked about the mental health technology transfer center, which was really around helping provide school-based mental health training and technical assistance. That contract has sunsetted, and there is a new there's going to be a new provider and a new iteration of MHTCC that is forthcoming. So if you go to their website, you will see that some of their resources have been archived and some have not. It depends on the region. They're kind of like the Prevention Technology Transfer Center, so they are based by region. So there's some really, really good resources still available there. And then hopefully forthcoming a new TA center to help with school-based mental health treatment. But what I want to talk about is NTAC, the National Training and Technical Assistance Center for Children and Youth and Families Mental Health. And we provide training and technical assistance across the system of care. So anyone that's providing mental health services to youth in community, wherever it sits. So it could be child welfare providers, schools, primary care, all of these preventionists, criminal justice. So we're there to provide services and supports to help those providing mental health treatment in system of care. ntacmentalhealth.org. They have a fantastic YouTube channel also. Go back a lot of the things that you all talked about, youth advocacy, lots of equity trainings, all on that YouTube or you can go just directly to the website. The other thing that I wanted to uplift is the Healthy Knowledge Portal. For those of you who are looking, I know there's some states that certify prevention specialists. For those of you that need continuing education units, this houses free online learning and low-cost CEs for behavioral health professionals. I wish I knew about this about 2 years ago. And because there are public courses that were funded through some type of federal funding, and they're all on this portal. It's fantastic. So if you have a question or you're just thinking, oh, I don't know what DBT is or CBT, what are these clinical approaches that I hear about but I don't know about? You can go on and learn about them and get a certificate even. So really, really good resources. The next thing I want to show, these are just some different kind of materials and approaches that were done by MHTCC. One thing I want to point you to is Project Aware. Project Aware is advancing wellness and resiliency in education, and it supports school mental health related training and TAs. There's over 90 Project Aware grantees. It's an application that opens every year. If you think your community is poised to look at that as a grant, I would definitely look into it. And the new MHTCC, I know this is so confusing because the other one sunsetted, and it was just at the end of September. So we're like in that 1 or 2 months that we're like in the middle, federal funding stuff. So they will support the grantees for Project Aware. So great, great resources. And I know we're running low on time. So
Well, I want to emphasize the fact that there is a best practice registry. And the goal of that registry is to increase health equity by providing access to broader selections of programs and interventions, including those upstream approaches, and also the ones that use different types of evidence, such as community and culturally defined evidence to show effectiveness. So here's a link for that website and Best Practice Registry. It is a resource for you. It's a wonderful library of programs and interventions that apply suicide prevention frameworks for specific populations and uses as well. Another resource for you. Overall, we just want to stress some key points as we close with you today, and that is implementing health initiatives is not just about addressing immediate needs. It's about laying the foundation for a healthier future for our youth. And by prioritizing mental health, we can significantly reduce substance misuse and enhance the overall quality of life for young people. Of course, some key points is tailored programs have to be culturally sensitive, and they have to be tailored to the specific needs of different youth in the population. And you have to make sure your approaches are inclusive, ensuring that all youth, regardless of their background, have access to mental health services. You want to make sure that when it comes to policy and advocacy, that you have supported policies. Advocacy for policies that support mental health and substance misuse prevention is essential. And then ensure that you have adequate funding for mental health initiatives that sustain long-term efforts. Those programs that just come and go and fly by night, I don't know how much harm they do, but that's one of the things that we do as prevention. We make sure we do no harm. So we want to make sure things that we do are sustainable. And then you want to collaborate. You want to collaborate with partnerships. And so you have multiple stakeholders who are collaborating between schools, between healthcare providers, community organizations, and then the most crucial part is the family. We know the family is crucial in bringing this all together. With the messages that we're getting at school have to be consistent with the messages that they're getting at home as well. We need to share our resources. Pooling our resources and our expertise is going to create a more comprehensive support network. And as Cindy has so eloquently said, early identification is really the key. We have to detect early any mental health issues in order to prevent substance misuse. If we can identify early on some of those mental health issues, then we're better in a position in order to help. And then we have to have a supportive system. We have to provide a mental health support early that can reduce the likelihood of you turning to substance to cope with their challenges that they're experiencing with their mental health. So it's not about which came first or came last. It's about making sure that we keep our eyes open as we're doing our prevention work within the communities. We recognize early symptoms, as you saw in the video that we showed you, and we don't wait until they have a substance misuse problem for us to intervene. It is time for our final thoughts. And I want to thank you all for your attention engagement throughout this presentation, because we've explored a critical intersection between mental health and substance misuse among youth. And it's clear that addressing one can significantly impact the other. So by implementing comprehensive mental health initiatives, we can create a supportive environment that not only addresses those existing issues, but also prevents future ones. If you want to answer in the chat right now, I just want to ask you, what tools or resources are you going to look into after today's training? Tell me, what tools and what resources are you going to look into after today's training? I hope you jotted down a few notes about some things that you're going to use. We shared a lot of resources with you, and that's why I'm asking this question. What tools or resources are you going to look into after this training? National Training Technical Assistance Center. Thank you, Bill. 988. Okay. Thank you, Mr. Fields. Teen mental health. Lunch bunches. Okay. I like the lunch bunches. Men's health best practices. Yeah, just flowing in. This has been such a wonderful group. It's essential to remember that each of us has a role to play in this endeavor, whether you're an educator or a parent or a healthcare provider or a community leader. Your efforts can make a tangible difference in the lives of people. So I want to thank you again for your dedication to this important cause, and I look forward to seeing the positive impacts that you're going to have in your communities. We're going to do a little Q&A with I guess, in our final minute, but this is an opportunity right now to get some feedback from you. We want to ask you to please complete the survey. We're going to put a link in the chat as well. And also, if you decide to sign off, if you weren't able to access it, then you'll also get a pop-up screen that will lead you to the survey as well. So you only have to complete it once, but we want everyone to complete it. And if you have a smartphone, you can just use the QR code on your screen right now and go ahead and pull that up. My name is Derek Newby. Cindy Rivera has been with us today and shared her expertise in this area, and I want to give out a special thanks to her as well, and the people that she represents and the work that she does over these 2 decades of her life already. You can contact me at the Southwest PTTC Region 6 if you have any additional questions for Cindy, or I think she put her email into the chat. You can contact her directly. But I'm at dlnewby@ou.edu. And we also have a website. Come to the Southwest PTTC website. When you get there, join our mailing list so you can get information on upcoming classes. And we also have a whole library of products and resources. So I promise you we will start on time and that we would end on time. We've had a wonderful opportunity for discussion all throughout the program. So I think y'all will forgive me for the Q&A part that we wanted to do, but we want to make it fair for everyone. If you have to leave at this time at 12:30 my time, Central Time, then you are free to leave once you complete the survey, and you will get a copy of this presentation in about 2 weeks. Any final words from you, Cindy, as we close?
Just a sincere thank you, and keep doing all that prevention work. If we get prevention right, we get the whole system right. So let's keep at it. So yeah, have a great weekend, everyone.